Well, good evening, gentlemen. I'm recording this session. Anybody have any problem, please do let me know right now. Otherwise, you can leave the meeting. Anybody have any problem? Okay.
No, sir.
Great.
No, sir.
So the exercise which we're going to do is called Ppdt. I'm going to share one picture, a hazy picture for 30 seconds. You have to observe that picture very carefully. After that, I'll give you 1 minute to write down the details. In details, you have to write the number of characters you have seen, what is their gender, age, and mood. Gender, whatever you're perceiving. If you see a male, mark it as a M. If you see a female, mark it as a F. If you're not able to recognize the gender, mark it as a P. Okay. If you see a positive mood, mark it with a plus. If you see a negative, mark it as a minus. And if you're not able to recognize a mood, especially, you can mark it as O, neutral. Okay. Or it's a neutral mood, or some not happy, not sad, neutral one. Okay. You're not supposed to describe the picture or write the story around the picture. Okay. So after 1 minute, you'll get 3 minutes. So total, you get 4 minutes, 30 seconds to wind up your story. Okay. So, and you have to encircle your protagonist or a hero to which going to take the action of the story. So what has happened in the past, what is going on in the present, and what could be the likely outcome. All clear? Anybody have any doubt? Ask me right now. So get ready with the pen and paper, everyone.
You stop writing, everyone. Please put your pen down. Now close your book and keep behind your back. सबकी पीछे होनी चाहिए, ठीक है? Quick, 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 quick. Everyone, जल्दी करो. Okay, guys. So the next part is a narration part. Okay. Now one by one, each and every individual have to give the narration of their particular story. Don't try to take more than 45 to 50 seconds. Okay. Once I ask you to just stop, like next, then the next person have to narrate their story. All clear? Anybody have any doubt? Okay. Then during the course of this, once the last part done with the story, you have to start your discussion. And during the course of discussion, you have to come up with a common group story. And you have to select one leader who is going to give the group story. All clear? Okay, Naval, you can start, please.
Good evening, gentlemen. According to my perception, I perceive two characters. One was male, it was around 29 years of age, and another one was female, that was around 80 years of age. And the mood of the male was negative. So the action I perceive is that completing his dream. So Rohit was a young child. He was living in a village in Kerala. So he belongs to a poor family. His father has been died in the past few years. So all the responsibilities of his house all the expenses he has to manage on his own. For that purpose, he was very challenging guy. He loves to took challenges. So for that purpose, he hustled a lot in his life. After that, he becomes a software developer. So one day, when he was returning from his job, he sees that his mother has no more. So he felt very sad for a few days.
Good evening, everyone. From the given picture, I have perceived two characters. One is male and one is female. Age between 20 to 26 years. And the action of my story is taking care of her younger sister. And the protagonist of my story is Ajay, who is 26-year-old, working in a company in Gorakhpur. One day he come from his office and saw her sister lay on the bed and is pleasing very much. To see that, he go to her sister and hold his hand on her forehead, and that her sister is suffering from fever. So he take a blanket and put it on her, and after that he take cold water and cotton put it on her forehead, and after that he called the doctor.
Next.
And
Good evening, gentlemen. The story which I perceived from the picture, there are one female character and one male character, age group between 25 to 45. So my main character Vinay Sharma, who has recently cleared his BE electrical engineering, and he is recruited in a well-known well-known company with a decent salary. He is from a poor family background with which he has no father, and he had faced a lot of struggles, and his mother is used to fulfill his dream. She used to took care of his needs. He used to be made in different houses, and he used to fulfill his needs. One day when
Next.
he came
Good evening, gentlemen. From the picture, I perceive two characters. One is male, age group between 35 to 40, and another one is female, age group is between 30 to 35. Both moods are negative. One day, Ram returned from his office and saw his wife lying on the bed. And he noticed that she is not moving for a while. So he checked her and got to know that she is no more. So he soon got into depression, uh, and he felt sorry for himself because she asked him to take to hospital, but he didn't take due to his work. Later, he took care of his family, his children, without marrying another woman, uh, gave
Next.
a family a priority.
Good evening, gentlemen. From the picture, I perceive two main characters. One is male and the other is female. The age group of male was between 25 to 30 years, and of female is between 30 to 35 years. The mood was neutral, and the action of my story is medical. Uh, medical. Uh, so, Anmol was pursuing his last year in medical Ames, Delhi. One day, as he was in his uh, vacations, he he found that in evening he found that a stranger came to help. So the stranger asked him for the help. He immediately went to his home and found that his lady uh, was in pain. She had got
Next.
a fracture in her ankle.
Good evening, gentlemen. I have perceived total two characters from the picture which is shown to us. One is male, whose age is 25-year-old. One is female, whose age is 40-year-old. My story goes like this. Rahul was working in MNC in Delhi. One day, when he came to his home, he found that his mother was in ill condition. So he thought he immediately called the doctor. When doctor came, he helped him by bringing the medicine from the nearby shop and asked about his mother's health and requested to doctor for proper treatment so that his mother would not suffer much. And after this, Rahul took a leave of 2 3 days from his company so that he can be with his mom and his proper treatment would be given. Thank you.
Good evening, friends. From the projected picture, I perceived a female and a male of 24 and 26 years respectively, and the mood of the story is negative. Ajay was a manager in a bank, and he got to know about his wife having some oil spills over her. As soon as he understood that, he rushed to home to hospitalize her. He took her to the hospital and got her treated by the doctors. The doctor prescribed some medicines. He, with his wife, returned back to the home with medicines. He assisted his wife with the household needs, and he also took care of his wife with the medications that were necessary. Later, he also made sure that he cooked all the food for her and asked her for bed rest for 2 to 3 days. And slowly, with the proper treatment, she was getting recovered, and she had a healthy life later. Thank you.
Good evening, gentlemen. I perceive from the picture there are two persons. One is male and other is female. Age around 24 to 26. Sunil was a civil. Sunil was a civil executive engineer who got a job in Manali due to winter season. His sister is very ill due to fever. After that, when he go out from his house at the time, he saw in the emergency condition, and he immediately take the first aid and call the emergency number of ambulance. And at the time, after few hours, the ambulance come to his house and then rescue him after and to the hospital.
Next.
After that.
Good evening, gentlemen. In the picture shown to us, I have perceived two characters. One is male and another is female. The age group is between 22 to 28 year olds. The male has male having mood positive and the female having the mood neutral. Raj is the main character of my story. He works in a private company. One day he returns to his home and he see that his wife was unconscious, and when he went to his wife, he came to know that she was suffering from fever. He immediately took her wife into the car and went hospital. After doing all the formalities in the hospital, he admitted his wife, and he took care of his wife. And after the 7 days, his
Next.
wife.
Good evening, gentlemen. According to my perceptions, there are two characters in the story. One is male, second one is female. Male is in negative mood and woman is in neutral mood. Male is 23 years old and woman is 40 years old. The story goes like this. Suraj, who is 23-year-old boy, and he's working in the MNC. After coming back from the work in the home, he saw his mother lying in the bed, and he caught that she is ill. And after that he called his personal doctor, and the personal doctor came after that, and he checked her, and after that he come to know that she got typhoid. So doctor gave her the medicine, and for that he had taken leave from
Next.
the office.
Next.
Good evening, gentlemen. From the picture, I have perceived two characters. One is female and another one is male. The male is 24 years old, is in positive mode, and female is 49 years old, who is in neutral mode. The action of my story is medical emergency. Rahul, who is a college student, one day when he was going to his college, he saw her mother was lying on the bed. He suddenly went to her, he checked on her. While checking, he checked that her mother was, the temperature of her mother was very high. He suddenly went to the next room to search for the thermometer, but he couldn't search. He suddenly called the ambulance. And while the ambulance was coming, he put her some wet cloths on her head so that he can reduce the temperature of her body. And when the ambulance came, he took her to the hospital, and there she got the possible medication that she required. And after that, they came home. Thank you.
Friends, I have perceived two main characters, one male and one female of the age between 25 to 30. The mode of the picture is neutral and my action plan is medical treatment. Rohan was an intelligent and responsible doctor. During his duty hours, he attended the person whose temperature was very high. Seeing the patient, for a moment he was disappointed, but he did not get deterred. With all his hope, he started his treatment along with his team. Even the nurse along with other doctors assisted him to get the patient recovered soon. The person who was lying on the bed recovered soon. Rohan was very happy and thanked for his team for all the efforts. Thank you.
Gentlemen, I have perceived two characters from the story. One is male who is 28 years old and one is female who is around 48 years old. Aman, who was MBBS doctor, was practicing in AIMS Delhi. Once his friend's mother uh, was operated by thyroid, and after her operation, she was supposed to have post therapy. Her Aman's she was Aman's friend's mother. So Aman used to go to her home to look after her, and he assured her, he gave her courage about she would be well very soon. And thank you.
Who's next? राम गोपाल सो रहा है क्या तू?
नहीं सर, मेरा नंबर तो सर 15 है.
Sir, 14, Himanshu. Actually, there was problem in the video.
Okay.
Gentlemen, through this picture, I perceive two characters. Gentlemen, through this picture, I perceive two characters. Male, 28 years old, mood negative. Female, 27-year-old, mood positive. The action of my is caring wife who is infected with COVID-19. Ramesh, a 28-year-old boy from Lucknow, got married to Vimlesh. As COVID-19 was infecting, so Vimlesh also got infected with the COVID-19. He was in danger as he had high fever. So, seeing this, Ramesh was initially very emotional, but he controlled his emotions and talked to his friend who was a doctor, and he suggested him that he should quarantine his wife for 10 days and care about her.
Good evening, gentlemen. On getting the information of mother's ill, Pankaj Kumar and software engineer working Delhi at Suzuki company came to home, see the mother's condition, got upset and take to the nearest hospital and took doctor advice. Doctor said to do a USG. He did the USG and come to the doctor, and doctor said to do a surgery. He did the surgery and took care his mother, and after 3 months his mother became strong and healthy, and he is finally go to his company and join, and he again start his job. Thank you, gentlemen.
Good evening, gentlemen. From picture, I perceive two characters. My main character is Ritesh, 29-year-old, mood is negative, and other is female, age around 28, and mood is neutral. The action of my story, giving medical treatment to his ill wife. So Ritesh, 29-year-old, is a school teacher. One day after coming back home, he saw that his wife is lying on bed and got high fever. So he became very sad, but immediately he gave her some paracetamol and called doctor, and doctor came gave her treatment and got that. After after taking blood test, he found that he got typhoid. So doctor gave medicine, and after treating couple of days and giving medicine, her wife became well. And
next,
thank you.
Sorry, sir. Good evening, gentlemen. From this picture, I see two main characters. One is male and another is female. Male is around 15 to 30 years old boy, and the female is 40 to 50 years old lady. She is his mother. She is ill, and his boy is a student. He is ready for the schooling, and suddenly he saw her mother. Her mother. Her mother illness. her mother is so ill, and yeah, they are belongs to a poor family. They are not affordable. They are not affordable. The fish of hospital. He, I, she is lying on the bed, and the boy is crying. And thank you, sir.
Very good evening, gentlemen. From the given picture, I perceive there are two characters, one a female, another a man. The age is between 28 to 32. The action of my story is repenting the loss of his wife. Ram and Sita recently got married, and after a few years, Ram discovered that Sita carries a terminal illness. After doing a thorough diagnosis, it was discovered that her disease is incurable. And after that, Sita deliberated it amongst her parents, and she decided that she will be spending the rest of her days with her loved ones. So they came back home, and she started to live the remaining of life. One fine day when Ram came back from office and was reading her a bedside story. Thank you.
Good evening, gentlemen. From the picture, I perceive there are two characters. One male who faces 32 years in neutral mode, and second is female of 28 years in neutral mode. The action of my story is seeing the illness of his wife. Naveen and Asta is a married couple, and Naveen works in a multinational company called Fit in Gurugram as a software engineer. One day, his wife called him and told him about his illness and vomiting from the uh, early morning, and then he went to his boss and completed his daily targets. And by evening, he went to his home and checked her condition, and then he took her into his car to the hospital, and they came to know about that his wife is pregnant, and they soon become parents. Thank you.
Good evening, everyone. The picture shown to us are perceived two characters from it. One is male, 18.
Pankaj, I don't see that energy. Okay, थोड़ा powers के साथ बोलो आप. समझ रहे हो ना? Start.
Good evening, everyone. The picture shown to us are perceived two characters from it. One is male, 18, female, 40. Both of them are in neutral mode. Action of my story is son immediately returned home after knowing that his mother was unwell. Rohan, 18 years old, studying in class 12, very fond of adventurous activities. He used to play football after the school. Today, he decided to skip that football match because since his mother was unwell. He immediately called a doctor for her, and in the meantime, he made her a cup of tea, and soon the doctor came and treated her, and she got well, and he went on to play his football match. Thank you.
Good evening, friends. From the picture shown to us, I perceived two characters. One is male, age around 23, and mood is negative. One is female, age around 40, and mood is neutral. The action of my story is taking care of mother. Raghav was final year MSc student and used to live with his mother as his father was out for his work. One day when he was returning from the college after the exam, he found that mother was ill. He immediately called the doctor and gave the medicine prescribed by the doctor. He did the household work and put efforts on mother's diet. He prepared food and increased the fruits in her diet and fruit juice as well. He prayed for the God for the recovery of her mother. And the mother soon got well, and she blessed Rohan for his wishes and for his taking care. He was happy too. Thank you.
Gentlemen, from the picture, I perceive there are two characters, one male, one female. Male is 24-year-old and is in negative mode, and female who is 25-year-old and is in neutral mode. Action of the story is taking care of his sister. Ram, a 24-year-old man, was crying over his sister's ill health. His sister was suffering from typhoid since last 4 days and didn't show any recovery sign. He consulted his doctor about his sister's health, and doctor told him about that she will be soon fine in 2 to 3 days. Then he bring medicines for her sister, consulted by the doctor, and then he calm himself. Thank you.
Good evening, friends. From the picture shown to us, I perceive two characters, one male, other female. Both are in neutral mood. Age lie between 25 to 30 years. Action of my story is got electric shock by geyser. Rajesh was about to go to the office. He realized that some noise is coming from the washroom. After some time, he realized that his sister got electric shock. So, with the help of his mother, he carried his sister to the bed. After that, he realized that his sister was unconsciousness. So he bring doctor, and after some time, for the rectification of geyser, he bring electrician. And after that, he went to the office. Thank you, friends.
Hello everyone. From the picture, I have perceived there is two characters. One is male and one is female of age group 24 to 25. Both are in negative mood. The action of my story is to create general awareness. So Justin was the central character of my story. Justin was a college student. He pursuing his MSc in Government College Selana. He was very talented, and since the childhood he liked to perform stage show. In the college, he got a chance to perform a stage show and at a state level. So he sees the opportunity and start performing for the show. So during the show, they perform on the theme of creating on the theme of how to stop how to stop domestic violence against women and to inform the people that women are the important pillar of society. And they performed the show, and it was a very happy show, and they won the prize. Thank you.
Friends, it is very clear from the picture that we have to go around the theme of medical treatment. The person who is lying on the bed.
About the mood of the two
We can make our hero as
we have
the
seen
person who
that
is standing
the
in
female
front of
character
the
has negative character has the neutral mood, and
mood of the characters.
the main character has negative mood as he was in
We should
that
think
condition.
that the man has a
Gentlemen,
negative
majority
mood,
of us
the female has neutral mood.
Perceive two characters.
Everyone, let's speak one by one. Everyone, let's speak one by one.
Friend, we have to
It
speak one by one.
It is good point that let us speak one by one so that we can put our point in front of everyone. And friends,
in
we
majority of my story,
can clearly see that the person who is lying on the bed needs some medical treatment at this particular point of time, and our hero will help us.
one by one point.
From picture, we can clearly see that is the medical treatment issue.
In my opinion,
One by one point.
First of all, I think we should decide the mood of the gender.
Clearly, we see that the
When
male
it comes to
is
the mood of the gender, we will go to neutral mood
I
because
think that is the relevant choice for everybody.
we will not go for negative. Rather, we can so that we can take it for the positive mood.
friends, what I feel,
Gentlemen, as we have all
that
decided that the
we should say that
it as a positive mood because
he was the mother
one
of a
female is
human
lying on the male, so we can take it as a
about
neutral
60
mood,
or
and
70 years of age.
male is in the
Neutral mood
negative
is
mood.
correct, friends. So that we can go ahead. So that we can. And the person who is closing his eyes, we can take him as he was slightly disappointed seeing
So we can see the lady was lying on the bed, so taking care of why did the mood appropriately we can take care.
One's mother
as many of us perceive the
was
couple,
having
so
a
we have to
fever.
go with
I think first
Gentlemen,
of all
most
we
of
should
our
consider a negative story here.
is
Crying.
now
When the doctor
See
came
guys,
at
I
home,
think that we
Yes,
should
as
consider
we
a
see
negative
clearly
story
that
because
the
boy
male
was
is crying,
crying.
so we can
nearby
take it as
medical shop.
the
Yeah,
his mood is
friends,
at
it's
negative
not
mood.
crying. He was slightly
I think we should
disappointed
conclude that
by seeing
the boy was crying,
the
so the
pathetic
story is
condition
negative.
of the person.
Friends, can we
No,
take
never. We
Gentlemen, we
cannot
have to
take it as a
understand
negative.
male by
Rather, we can
male
stick to
about the
the.
time
the story was in a
unconsciousness.
And then we can take the story towards positive end by giving a recover soon.
one point
And we shall continue with the same thing.
Gentlemen,
The
let's
woman
agree
of
that the
24
first
years and the guy of
is
26 years are
person
brother and
who
sister.
perform his work.
Friends, we know that every one of us are revolving around
The
medical
medical
treatment.
treatment issue, so we can take that
We can
the
take the
male
common theme as Ram Ganga
close
Kumar is
relative to
telling
that
about
We have to
woman
decide the relationship
is
between
concerned for his for her medical treatment.
treatment, and we
the
can take
lady
him
is
as
lying on
either
the bed.
doctor or a person
Gentlemen,
from the corporate
Nearby,
office.
we should not
nearby her.
include
Included as a
another
doctor, we
person
can
because the
treat him.
third person
That
was
lady
not saying in the
Will have the
is
capability to
40 year
treat
old.
the patient as well.
Taking a high
taking a doctor or a
Gentlemen, as we
person
have
included
agreed
in the
that
story.
doctor
we there are
Let's
from the
outside
story.
where
common
male
conclusion
of
that
second
we
one
can
is
add
doctors
female.
will assist
experience.
the patient to
Then
get
we
good
look at
person.
that there is a question female is ill and male came to know that
Gentlemen, we are running out of time. We have to leave a common story. I think
Gentlemen, I think
come
he
to know
requires
that
If we are running out of time, so we shall just come to a common conclusion and
Gentlemen, so as we commonly
will
taking that
help us
is
to
a
understand.
Friends,
treatment issue, so and which is
going
relevant,
in
so
wrong
we
direction
think
can
that
take
we should
much
make common
point.
story
Friends,
based
we
on
shall
that.
come to a
Time.
common disease.
now we have
Yeah,
got one
friends, at
point.
this point of time, we can work on the
Common
common
stories,
disease
we
that
can take
it is
the
a medical
typhoid.
treatment.
Can we
Our
decide
hero is a
one by one?
doctor.
think you all
As we
agree with the
consider
story
typhoid
that
as the
What will
treatment
be
that the
basic
boy
and
was in negative mode
As
and
we
his
most
mother
of
was lying on
said
the
about
bed
the
dying.
typhoid is the
went to
typhoid
the
issue is there.
Okay, please stop it now. Well, if the way you guys discussing is difficult to come to common consensus, so what I'll do, I'll divide the group into two. Okay. So group one is Abhay Sarkar, Prince, Dimri, Daya, Pankaj, Umesh, Vikas Singh, Vijender Singh, Dinesh Kumar, Abhishek, Adarsh Singh, and Abhay Sachan are in group one, and rest of are in group two. Okay, group one, please start your discussion.
As
Gentlemen, we all have
That is what I
we all
think, in
have
my
this
opinion, as many of us
medical
perceive two
urgency,
characters.
so we
Common
can
story. There is a
think
common
Many of
that
us
lady is getting
and the point we can take it as a
lady has
and
a
we can
bond
also
between
say that
them.
the
We
lady
can
was
take it as a
unconscious
husband,
male
wife,
character,
or a
male
mother,
he
character
got electric shock.
a mother and a
mother
son.
Gentlemen,
has taken a lot of care of him, and now
we
it's
can
his time to look after
yes, we
her.
can take it as a
He
mother.
went back
Yeah,
home,
no.
and
we
then
can
he
take
took
it as
But
a
after
mother.
looking,
took her in
we
his
cannot look at
Or
it was
hospital,
observed
and
that
that
Friends, it is very
treated.
clearly visible from the picture that it is not a mother who is old age.
we cannot
Old
take
age,
it
it
a
is the
mother-son relation
Yeah,
because
yes, we can take it as a husband or wife bond.
He's a doctor or like he's working in MNC or
female
something.
can be female is
yeah, friends, at this point
Husband
of
is
time,
working in a MNC company, and when he
added to Dimri, we can
back to the
also say
home,
that the lady
woman
was
is
got
looking
electric
very old,
shock.
so we should consider it as a woman, and the
yeah,
male character as
I
a
think
Yeah.
Yes, we can take the woman as
she
the
looks
female's
like
mother.
Mother
Is ill,
son,
so
the son is
after
working in
returning
no,
from
MNC company,
office, the male
and mother was
saw
ill.
that
One day when he comes
she is
home,
lying on bed,
he
so
found that
immediately
mother
she
was ill. He called the
called
doctor
doctor.
and
Umesh,
gave the
please
medicine.
listen to Abhay.
yeah,
But
friends, we
Just
can give him medicines
we can
and
also say
medical
that
treatment to
the
the
lady
woman
was
so that she
the lady was
recovers
our
soon.
sister and woman. We can also say
Recovers
that
soon.
the lady was
we can
sister.
take this as a point.
Yes, we can
Yes,
add that.
we can take that. She
Friends, let us summarize all the points that we
as
have
she is
collected.
very ill, so the
Friends,
man
we can collect
her
all the points
some immediate
that we
medical
have
treatment,
collected.
and later on he
As
called
there
for
was
the
no
doctor.
third character
Yeah,
in the image, so
we should
we can
complete
take it as
conclude
that
We can
he
also
took
add like in the
took her to the
meantime he
hospital
made
And
her
at the end, we can add
by
that she
his
recovered
help
soon
in the ambulance.
with the collective
Calling
efforts
the
of
doctor is the
everyone. We
best
can add
option.
this.
If we can
Adding
also
to the
show
other
that the
point,
boy has remembered the thought that
after
the
the
effort
doctor
which
said
has
Added to
taken
Dinesh,
from her
added to
mother.
Dinesh, we can also say
Friends,
that
friends, I will summarize all the points that you have collected. Let me revise the things.
Let us put the
Okay,
Gentlemen, I
revise,
think
please.
we have concluded
Yeah,
the story.
let us revise the
common
friends.
story.
Friends, our hero is the male person who is of the age 25, and his
okay.
sister was ill, and he was not knowing about this.
We should consider the lady as a woman because she
He
is
was
Yes,
not
mother.
knowing about this, and when he came to know that his sister was ill, he was slightly disappointed. At last, what he can do is
Then we all have agreed that
he given some
her mother
medical
is
tablets
his
for
mother.
him.
listen.
with the help of his
We should
mother, he
consider
can
the lady as a
Okay,
woman because
please
she is
stop
looking old.
Yes,
Stop it.
because
We consider the
he
lady
might be
as
having his
his mother.
but
as the
we can
lady
show
was
in the
quite
story
old,
that
so we can make it his mother. So the mother was
No,
ill.
I don't think we can make the
yeah,
lady
we
old because that does not.
Yes, I agree with
after
Umesh.
careful observation, we can.
Stop it. Now, group two, please start your discussion from where the people left. Start.
Friends,
as we have made the story
as group one has decided that the lady
Yes,
was
guys, I
lying
think that they
with
were
a
going
doctor
wrong.
of Brown
Should
whose
consider the
age is
lady as an
40
older
year
lady. It
old.
was the mother of the
She was
bride.
suffering from the high degree
And I
fever.
think
single lady
that over there. So we should consider the story of that woman.
sister or his wife.
Her a better
Now,
treatment.
should
Gentlemen,
consider
that
the man
can be
as
cured
a
very
student
shortly.
who is pursuing his
Gentlemen,
MBBS
it's
from the
possible
age
that
10,
he
and
requires the
right
medication.
now
Now
he
it
is
is
don't
clear
think so
that
that
he
we
requires
should
the
consider the
medication.
man as
Now
a
we can
student.
discuss the other part.
Actually, he was a
What
working
about that
professional.
lady
No
who was
students
lying
waste
on the
time.
bed? That she could
Yes,
be
I agree with
40-year-old.
ma'am.
We
That
need
take
to
the age
decide
of,
who is
of that
lady.
lady.
He's a working
First of
professional.
all,
I think we should
And there
conclude it that the woman
Yeah, gentlemen,
has died,
either
so
man
she
is
has a
common
neutral
story
character,
that is
and the
there
man is
From the
crying,
picture
so
we
he
can
has a
or
perceive,
negative
action of the
character.
from the
story
pictures we
will
can perceive
be
that she
all
requires the
this.
If the
medication,
lady has
This
dead
lie on the
and
person,
bed
we
means
can
and it
take
is clear that she
that we are
requires the
curing the
medication.
lady.
Now we can
That
move
will be
on to the
better,
boy.
far better.
What's the role of the boy?
Yes.
We can
Okay,
move on
guys,
with
I
that.
think most of the
It is
guys are
clear.
agree with the story that most of the
But
guys are agree with the
I would
story
like to
that the
add
mother
that we
has
can
died.
take
yeah,
the boy
gentlemen,
as
most of the people
the
are being
Already
mother
as
is
we
agree
are
not
with
discussing,
the health issue
doing
problem.
medical
the
treatment.
lady
He is
was
telling
having high
something
And
degree
which is
fever,
also, he's
and the
helping the
doctor
lady
was
in a
giving
village
her
where
the
there is
treatment
no
that she can be
hospital or
cured
Because
very
I think we
shortly.
had made a story, so let me narrate it.
That-
Don't waste our time. I think we
Okay.
should make a story, so let me narrate it.
Yeah, gentlemen, about the health issue.
Are you all guys agree with me that I should narrate the story?
okay.
I would like to add a point that we can take the lady on the next day to a good hospital so that she can be cured well.
No, man, I think
Okay,
the lady has
Yeah,
already been
gentlemen,
died, so there is no need to bring
No.
her to
gentlemen,
the
our
The
hospital.
picture
hero,
is
I
very
think that
simple.
will be
Don't make it
overflowous.
too
difficult.
hard to the
Now
hospital.
the
Lady was
picture is
having
clearly
Then
giving the
he
direction.
has point.
Don't make it too difficult.
she
She was
needs
not
medical
died.
treatment.
She was
See,
suffering
guys,
from a normal fever, and she was lying
Aman, I
on the
agree
bed.
with
Doctor
Aman.
if she
was
was no,
Yeah,
I'm
she's
disagree
suffering
with
Gentlemen, he
you,
from
was
Aman, that if she
suffering
was suffering
from
with a
health
normal
issue.
fever,
And
how
the
should a boy
man
should
was
cry
to
taken
prove
to
the
then?
the
story, not
the
hospital
the
normal
story.
and
So
picture
please
after
agree
in the
with
normal
doctor
direction.
Aman.
Don't
advice,
make it so difficult.
he followed the
She was
doctor
not died.
advice
She was just
and
suffering
he
from the
became
fever,
Okay, guys.
and
health
his son
But
came to
the
the
Okay, guys,
home.
by
but the
listening
man
to all your
also,
When
points,
the
boy is
son,
not
let me
when
narrate
the
crying
our
son
common
came to his
despite
story.
home,
I think we guys had come to a
he
common story.
immediately
Let me
told the
narrate it.
doctor to treat his
Guys,
mother
please don't
so
waste the
that
time.
she.
Just
Hmm?
come to a common conclusion and start
Oh,
as soon as we can narrate it. Okay?
yeah, correct,
guys.
Nawal.
Am I permitted to
But
narrate our
but
story?
friends,
Okay, gentlemen,
this
our
is very
action
simple
will be,
picture,
I think
and we
our
can
action
take
will
that the
be
lady was
about
suffering from
health
a
issue.
normal fever.
And
Don't
she
make it so
was
difficult
facing
that
some
she was
I
problem
died.
agree. I
about
agree
health
with
issue.
Aman. He is saying
And
right.
our
We
hero,
can take
yeah,
the
I
leader.
agree
I
with
think, Aman,
also agree with Aman.
She needs the
Aman,
medication,
that the lady
and
was
the
died
boy is
over
there
there.
to
and
help her.
We
after
can't
taking the
consider that she
advice
was
of
like if she was
the
died, then only the
But the
man can
man
cry,
was
na?
advice
so sorrow, right?
and
But the
take
man
care
was
of
so
the patient,
sorrow,
She
It is
was
very
I
she
guess.
was
simple.
so
Don't make
one
it
sorrowed
so
point.
that
difficult.
I think
Friends,
everyone
the
is.
picture is giving the clear direction that she was suffering from a normal fever, and the
Typhoid as a
doctor was treating her.
treatment
I
of
think
AIDS.
but
everybody has perceived that
if
the
you had
lady
seen her
requires
Okay,
the
hand,
I
medical
Aman,
majority
treatment. She
is
has the
her
fever.
hand was
accepting
lying
that
dead over there,
Twice
like she was dead over there.
Friends, as majority
get
of us has
recovered
made
well.
on a health issue that she was suffering from
Yeah.
a normal
illness.
fever. Don't make it so difficult.
Yes, he was suffering from a
Yeah,
This is
disease. He
very
was
okay,
simple
suffering
okay,
from a
picture.
Naval, I
disease.
guess
I'm
we
agree
have to
with
The
Aman
agree with
that
doctor
we
was
him.
should
treating
come to a
her.
normal fever story. Okay,
Yeah,
guys, are you all
yeah,
agree with
correct,
that?
Nawal.
The
First,
common
Was
decide
suffering
her
story.
from a
age,
Yeah,
normal.
yes,
I agree
yes,
with Aman.
her
Yeah,
age,
gentlemen, but I want to share
Okay,
the
I
details.
think the
her
age
character,
I
and
think
the
the age
common
should
things,
be
so that we
around
can
60
conclude.
or
Okay, gentlemen. I'm giving you last 1 minute to discuss among yourself and do let me know who will be your group leader, who going to narrate the group story. Start.
Friends, what I feel, in my opinion, we have to
Friends,
give.
what we can do
We
is
should
we have
go
said,
for the medical
friends, we
treatment.
can
that
collect the
the woman
points
was
whatever we
healed
have
and the
we have
male
said.
after
I
returning
can
home
we can take the team as
All the
medical
points, so we
treatment.
have to
So
give the
lying.
Of the
give
person
her
is
medical
lying
treatment.
is
So
yeah, medical treatment is the
she
running team,
immediately
and
gave the some
we can go
The
emergency
lady's
medical
mother
treatment, and
some
later
guys
on
has mic turned
tablets
off,
to
so
her,
please
and
turn
then
on
we
the
can
mic,
take to the
please.
hospital.
started
As
Your
it
treatment.
was
mic
a
is
very
off.
After a
Komal
serious
couple
Syal,
of
your
days of
mic is off.
treatment,
Others, your mic
she
is off.
problem.
got well.
So the common
Yes,
story can be
taking her to the
Yes, I am
after
agree with
taking her to
Abhay
Yes, friends, Umesh has said right thing that we can take her to the hospital and
think that we
she
had decided a
recovered
common
soon
story.
after
Let
the
me
collective
narrate
effort of
it.
everyone.
Please don't waste the time anymore.
Friends, let's decide
See you
a
guys.
group leader.
Gentlemen, calm to the man. Gentlemen, he was lying on the bed. He was suffering
Now we
from
have
small
decided everything.
and after some time, and
He was
know
totally
the
fine.
But if a person who is very ill, so how can he manage to
Yeah,
go to the
friends, let
hospital
us
in the
not
same day?
discuss now. Let us
Giving
revise
emergency treatment
Can we recollect all the points?
sometime, or the later day she
Let us summarize and revise whatever we have said.
took her to the hospital.
In 3 steps. The first thing, the theme.
Okay. Now tell me who's a group leader.
Abhyas
Aman or Umesh, sir.
Abhyas Sarkar will be our group leader, sir.
We have to give
Amen
the
or
chance to
Umesh,
the
sir.
Aman.
I would like to
He's having all the
nominate
points.
Amen or
We have to
Umesh.
give
Friends,
the
if
chance.
you all are agree,
group
then I can.
leader, sir.
Friends, if you all are agree, then I can narrate.
I need a chance to go there.
Sir, if you all agree,
I would like to nominate
Sir, I
Abhyas
would like
Sarkar.
to nominate Aman.
Friends,
Abhyas
if you all are
Sarkar
agree
will be
with
the correct
Gandhi,
leader.
I can narrate the common
Friends,
story.
in my opinion, we have to give the chance to the Aman.
I think we
Okay,
should go with
let's go
Aman.
with Aman, guys. Most of the guys are agree with Aman, so Aman, you can continue to narrate our story.
Yes, Aman.
CAPF Sarkar, you can narrate the story.
Aman, you can continue.
Only the perfect one. Aman,
Okay, Aman,
narrate the story.
Aman, you got the honor to narrate our story.
Just I ask you one name, okay? I'm giving you last 30 seconds. Discuss among yourself. If no one come out as a single leader, I didn't find anyone with a majority. I'll make everyone do 50 push-ups straight. You decide. 30 seconds.
Afsb Sarkar.
Go for it.
Yeah, friends, as Aman has told the good story, we go with Aman.
Guys, listen to me.
Aman has come up with a healthy normal story. We can go with Aman.
See, guys, let's decide Aman as the leader.
Afsb was defining everything very well, so we should go with the Afsb Sarkar.
I think Aman
Let's go with Afsb was defining
Guys,
everything very well, so we should go with the Afsb Sarkar.
guys, and let Aman narrate our story.
Let Aman.
Okay, Abhay, start narrating the story.
Guys, let's
Okay, done. Abhay, start.
Okay, sir, we had decided to narrate Aman our story. Let the Aman narrate our story. Okay, Aman, you can continue. Just keep
Let the
quiet,
Abhay
guys.
narrate
Don't
our
come
story,
to
sir.
discussion now.
Take the responsibility to narrate the
Abhay is
So
the
we had
correct
decided Aman is
person.
our leader.
Okay, please.
So we have decided Abhay Sarkar.
story, sir.
We have decided that our Sarkar, sir.
Shall I proceed, sir?
Okay. So all agree with Aman. Anyone who's not agree with Aman?
Agreed. We agree.
Okay.
Agreed, sir.
Any other who's not agree with Aman? Only one we have. Any other who not want to Aman to be a group leader? Okay, Aman, give the group story. Start.
Yes, sir. Thank you first. Thank you all gentlemen for giving me the opportunity to narrate the common story. Shall I proceed, sir?
Proceed.
Yes, sir. Thank you, sir. Good evening, gentlemen. I have perceived two characters from the picture which is shown to us. One is male, whose age is 25 to 30-year-old, and one is female, whose age is 40-year-old. Rahul was working in MNC in Delhi. One day, when he came to his home, his mother, whose age is 40-year-old, was having a high degree fever and was lying on the bed. He immediately called the doctor to treat his mother so that the proper treatment could be given. When the doctor came, he helped him by providing all his possible medicine from the nearby medical shop and requested the doctor to treat his mother in a very good treatment. And after that, he took a leave from his MNC company to take care of his mother, and so that she could be treated very well in the short period of time. Thank you.
So all agree with the story?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
It's a group story or it's an individual story?
Yes, sir.
It's a group
Yes,
story.
sir. It's a group story.
Group story, sir.
Okay. Himanshu, narrate the group story. Himanshu, sing. Himanshu, give me 30 push-ups right now. Do 30 push-ups. Jaldi, quick. You forgot to turn off your this mic. You have to mute. You have to unmute. Give me quick. Time waste मत करो, जल्दी करो.